He says it's too expensive. He says you go home and die. So the statistics of deaths in Canadian hospitals and stuff, he goes, there's a lot of the statistics, back to the lies, and there's no statistics. A lot of them are jaded by, he said, the payment mechanisms and things. He says, in the way we do stuff, you stay out as much as possible. And he says, so the stats actually look very, very good. There's a lot of stuff like that here in the United States as well. And it's when, like a Kaiser does probably 95% of everything really, really well. A lot of the evidence-based stuff, I mean, all that. It's the edges that get messy. It's the edges. If you're that third standard deviation patient on the low side or that third standard deviation patient on the high side, that's where things get really sloppy because you're not used to working in that world all the time because it doesn't happen that often. And that's where I think some decisions, and again, I'm not a doctor, I'm not going to make a judgment on it, but we see things because we get the kids when things aren't working, they come to us. And then we'll see things and say, if that kid had only been here a month ago, we could have, now you're not going to be able to save those eyes or whatever. It's too late. Because people aren't used to seeing certain rare things, and they keep trying and trying and trying until they kind of dig themselves into a hole. And that's the part of it doesn't work. And how you take that into consideration across the continuum and across the whole, so you get all the great benefits of things like these guys do, and yet still pick up those edges, again, I'm not qualified to say. But there are issues there, I will tell you that, because I've sat in lots of rooms with closed doors and we've had conversations about them.
Tease up well our next topic, which is ACOs and care innovation. Ernie, can you kick us off and talk a little bit about, first define for the audience what an ACO is, Accountable Care Organization, that came as out of part of PPACA, and then a little bit about your vantage point.
Well, that PPACA thing that's the government doing their thing. ACOs to me is sort of the real world solution to managing costs of care. An Accountable Care Organization essentially is an organization responsible for the care of a given population of patients. And an accountable care organization starts, in my mind, with a primary care physician in a medical home and the doctors that I was talking about controlling the cost of care by doing the appropriate things for those patients and making sure they go and get the services they need when they need them, and with the support that they need to proactively provide the services that people need to manage their lifestyles, which we talked about before. And getting patients, diabetic patients, into a regular program where they see somebody once a week and manage their weight and eat properly and all that stuff. An accountable care organization to me is the private marketplace's solution to runaway costs of care.
Tim?
I agree with that. I mean, I think it's, it's just that somebody is taking responsibility, coupled with, I think, should be some of that personal responsibility we talked about earlier, but to try to care manage. As I was listening to Ernie talk, I think one of the bigger trends you're going to see in the next decade is going to be a lot more care management. And it's going to come through a lot of different mechanisms and different ways. But it's to be able to do the kind of things that actually Kaiser and others do well, to walk a patient through the continuum of, especially if they have multiple systems issues and stuff like that. They just don't have one disease, but I have maybe several diseases. You really need somebody to help walk you through the process of getting only the care all the care you need, but only the care you need. Timely and that kind of thing, because the healthcare system is, with all the new techniques and new things to be done, the good news is there's a wonderful array of things that you can have done to you. But not everybody knows about them, not everybody does them all the time, and they're not widely available all the time and all these different kinds of things. So it's good to have somebody who understands the lay of the land, knows how to triage you and triage care at some level.
Liz?
I am born in the era of managed care. Actually, I first was